everyone. My name is Dr. Nnenna Ezeilo, and I'm here with Zebralter Medical, which is a non-for-profit that's dedicated to connecting Black scientists with communities of color.
What is otolaryngology?
I am a physician specializing in otolaryngology, head and neck surgery. I know that's a mouthful, so what exactly does that represent? It's colloquially known as ear, nose, and throat surgery. This means that I provide medical and surgical care to both pediatric and adult patients with ear, nose, throat, sinus, endocrine, and early stage head and neck cancer issues.
How did you decide on otolaryngology as a career choice?
I discovered that I loved surgery and that I loved otolaryngology head and neck surgery during my clinical rotations in medical school. I actually thought I would be an internist. So this just shows the importance of keeping an open mind and getting a wide array of exposure while in your medical school because your interests can change.
What is the compensation for otolaryngologists in the nation?
ENT surgeons are well compensated for the work they do, just like any other surgical specialty. The starting salary is about $340,000 for an early career physician and can go as high as over $500,000. So you'll be well compensated for the work you do.
What is the value of mentorship and how has it helped you?
Mentors have been central to my professional development. As a fourth-year medical student, I was fortunate to have mentors in my corner who wrote me strong letters of recommendations that helped me match into the field of otolaryngology head and neck surgery. Then, as I transitioned from being a resident physician to an attending physician, mentors were central in helping me evaluate career options and negotiate total compensation packages. So mentors will be central to my development moving forward.
Who's likely to succeed in your field?
I believe that someone who is conscientious, has good attention to details, sociable, good communicator, and a great team player will succeed in ear, nose, and throat surgery. But because you work on a team, providing interdisciplinary care to a patient, it's important to be able to be facile and adaptable.
What is the percentage of underrepresented minorities in your field?
I don't know the specific numbers for Black ENT surgeons in the US, but I do know that only 5% of physicians in the US are Black, and only 2% of those Black physicians are women. So I can conclude that the number of Black surgeons and Black ENT surgeons are very low in the US.
Do you think we need more underrepresented minorities in your field?
Yes, I believe we need more underrepresented minorities, not only in ear, nose, and throat surgery, but in medicine in general. Having these diverse providers, they bring with them their diverse experiences and cultural competency in patient care. My minority patients are very excited to see me in clinic, and I get to know them more as a patient, and that certainly positively impacts my delivery of care. My father is a physician as well, and seeing him in that role made me feel that my dreams were feasible.
What does a typical workday look like for you?
My typical week involves working in the clinic and in the operating room in the hospital. I'm typically in the clinic Monday, Tuesday, Thursdays, and Fridays, while I do surgeries in the operating room at the hospital on Wednesdays. When in clinic, I see new and established patients, including pediatric and adult patients. Then in the hospital, I care for patients and do surgeries for all variety of complaints, from ear tubes to tonsillectomies, sinus surgery, thyroid surgeries, and diagnostic procedures.
What's your advice for those wondering if they can pursue a career in otolaryngology?
So my advice for, say, a high school student who is looking into ear, nose, and throat surgery, or even a college student, is get exposure. Shadow and observe an ear, nose, and throat surgeon so that you can get a better idea of what they do. And certainly be grounded in your sciences, because medicine is a science-based course. But at the same time, you want to bring humanity and humanism to it. So you have to show empathy, sympathy in your care for others. And certainly work hard. You have to study well and make good grades in order to go into medical school, which is competitive, and surgery, which is also competitive. But at the end of the day, remember to take time out for yourself and remember to keep yourselves grounded with a support system of those that love and care for you.
Are platforms like these relevant? If yes, why?
I believe platforms like Zebralter Medical are absolutely needed. They connect Black scientists to communities of color. I cannot understate how excited I was to meet a fellow Black ENT aspirant when I was on the interview trail for residency. It felt grounded to know that somebody else had the same dreams as mine and that we were pursuing it with so much gusto. Seeing an example of someone who's a successful surgeon, a successful Black ENT, makes you feel like those dreams are completely achievable and that those dreams are valid. You have mentors, potential mentors to look forward to model your life and career after. I believe that platforms like this are central to showing good examples for students of color.